In this video, we're going to assess the feet. So when we're looking at the feet, we're actually going to be looking at 3 different systems within the body that can affect the way my feet might look or feel during an assessment. So the first thing we're going to do, just like any part of the system, is we're going to inspect. So what I'm going to do first is look at the ankles and come down to the feet. So I'm going to be looking for symmetry, I'm going to be looking for the same size, the same shape of the feet and ankles, but I'm also going to be looking for edema or swelling in the ankles and feet. So when I'm looking at edema and swelling, I'm thinking with the cardiac system. Okay? So edema can be a multitude of things. If you have a unilateral edema, meaning on one side, it could be related to something like cellulitis. But if I have an edema on both sides, it could be related to something like congestive heart failure. Okay? If you do have edema, the way you want to assess it is you're going to see if it's going to pit. Okay? So pitting means you're going to take your finger, 1 or 2, and you'll pop it into the areas where it's swelling and see if it makes a little pocket of your fingers and how deep your fingers might go. This is based on a scale of 1 to 4, depending on how deep the pitting is. He doesn't have any edema or pitting, so we're going to move on now. So the next part of your inspection is actually going to look at the musculoskeletal system. So for this, I'm going to be checking his range of motion. So I'm going to have him invert his feet, meaning he's going to move his ankles and feet towards the end of his body, and then evert his feet, moving them away from his body. So you're going to want to check for full range of motion for the ankles there. And now we're going to look for range of motion for the actual foot. So I'm going to have him plantar flex, meaning he's going to point them down, and now dorsiflex, meaning he's going to point his toes upward. Okay, and he appears to have full range of motion there. So that is awesome. So now I can move down with the inspection and come and look at the actual knuckles or toe bones here. And I'm checking for any lumps and lesions, any swelling along the knuckles and the toes, and I see nothing. Okay? So some abnormals you might see, especially for people who have something like rheumatoid arthritis, might be hallux valgus. So hallux valgus means that these big toes are going to actually come in towards the body. Okay? So they kind of separate off, they come pointing into the body, and your other toes have to compensate for the loss of balance that you lose from your big toe by bringing up and hyperextending themselves like this. Okay? And it's called hammer toe. So he doesn't appear to have any of that, and again, that's just an abnormal that you might see with something like rheumatoid arthritis. Okay? So now, after inspection, I am going to see about palpating. So another thing we can look at with the cardiac system with your feet is your pulses. So I'm going to feel for my bony prominence. Okay, I have 2 pulses. I have a dorsalis pedis and a posterior tibialis. The dorsalis pedis is a little bit more difficult to find, but if you use the bony prominence along the top of the foot, and then this bone right here for your second toe, it kind of makes a little V or a little pocket. Okay, if you take your 2 fingers and you place them into that pocket, you'll find your dorsalis pedis pulse. Okay. My second pulse area along the foot is going to be the posterior tibialis. So you're going to come under the ankle bone here, and it's located just almost to the back of the heel. And there it is. One final thing we can check for the cardiac system in my feet is capillary refill. So you're going to come and you're going to push the nail beds together, and you're looking for the color to come back after about 2 to 3 seconds, or a little less than 2 to 3 seconds. Okay, so you're looking for oxygenation in the blood with the capillaries. And it seems to be just fine. It doesn't appear to have any cardiac problems or vascular problems for the feet. Okay. So the final system we can check while looking at the feet is their neurological system. Okay, so I'm going to check this with reflexes. So the first reflex we can check is back here along the Achilles tendon. So if I were to take a reflex hammer and hit just right above the ankle and back on the Achilles tendon, he's going to have kind of a jolt or a dorsiflex up. Okay. The next reflex is going to be called the Babinski, or called a plantar reflex, depending on the book you're looking at. Okay. And this is when you're going to take the foot and you're going to draw an upside down J. Okay. A normal response would be for him to curl his toes in. Okay. So again, that's the plantar reflex. It's an upside down J along the sole of the feet, and he's going to curl his toes in as a normal reflex. An abnormal reflex would be a fanning of the toes. Okay. And that might be related to things like brain lesions. Okay, so now that we have looked at the cardiac system, the musculoskeletal system, And the neurological system, as it relates to the foot assessment, we can think of things now like chronic diseases such as diabetes. So for these people, you might have loss of feeling in the foot related to the neuropathy caused by the diabetes. For that case, we really just want to check feeling, okay? We want to see if they feel any tingling, any numbness when we push, but also we're really going to be concerned about teaching them to take care of themselves at home. So these people are going to need to inspect their feet every night. In other words, they're going to have to look at the bottoms of their feet, the back of their feet, and all around to make sure that there's no cuts or scraping so they can avoid infection, okay? They also can wear soft-soled shoes, or you might want to have them bathe in sitz baths to kind of keep it warm. And that's what I have for the feet.